A month or so ago, I interviewed Dr. Gosia Gasperowicz from the University of Calgary about her COVID-19 modeling for Alberta. And she talked about how the Alberta Health Services modeling was incompetent and couldn't be trusted. Well, since then, we've now seen the effect of some of the government's policies that were implemented in the summer and early September. And lo and behold, what do we find? But elementary school kids are the drivers of the fourth wave. They have the highest infection rate. So I want to check in with her again to see what kind of insight she's got into, how the link between policies and infection in kids, I guess, is the best way to put it. So welcome to the interview, Gosia.
Thank you very much for inviting me.
Well, look, you've charted out the data. What does it tell you?
So we see that the elementary school kids have the highest infection rate among all the age groups. Currently, now in all the age group, we see the decline in infection rate, but still, the elementary school kids have 50 daily new cases per 100,000 population in this group. Other groups are around at 30 new cases per the group, so almost half less. They also had the fastest, when all the cases were growing, then they had the fastest growth rate among all the age groups. And yeah, so that's really striking that this age group is the most infected. And compared to the group 0 to 4 years old, so they are 100% of them are not vaccinated because they are not eligible for vaccination. But when you compare them with 0 to 4 years old, which are also 100% not vaccinated, they have much lower level of infection. So at this time they are 23, so half less per 100,000.
Just to clarify, it's the 0 to 4 years that is half of the 5 to 11 year rate?
Yes.
Gotcha.
Mm-hmm. And the difference between them is that the 5 to 11 are at school and 0 to 4 are not.
Okay, gotcha. And your argument is that it's very clear that removing policy measures in the summer and then early September is what has led to the situation we're in now with that cohort.
So yeah, the plan for reopening schools at the beginning of September by Alberta Health and the government was, so in the plan at the end of August, beginning of September, there was no masks, no air filtration in schools. They also abandoned precautions that were present. So they removed precautions that were present last year. So they removed cohorting, they removed contact tracing, they removed asymptomatic testing of close contacts, and most importantly, they removed informing parents who is infected and that there was a positive case in school, right? So basically all these elements are accelerating the spread. So if somebody would like to infect as fast as possible, as many kids as possible, one would just need to copy paste this as a recipe. And okay, now we have masks in schools, but it was after strong advocacy for that. So it wasn't that Alberta Health came up with the idea of masks in schools. There was strong public outcry to have them. Still, there's no air filtration. People have difficulties to install air filters, and there's misinformation being spread that HEPA air filtration systems are dangerous or something, which is absolute misinformation because they are not dangerous. And yeah, and now we have test, trace, isolate. I think it was last week that it was announced that it will be back, but Alberta Health will start doing it by themselves in mid-November. So now it's dumped on schools to do it. And it's also after a strong public outcry. So again, it didn't come as a non-nudged idea from Alberta Health.
So just to recap, we had some policies in place that appeared to work last school year. All of those were removed heading into this school year. We see infections in the 5 to 11-year-old spike. They're the numbers 50 per 100,000 in that population. Then the government and Alberta Health Services reacts And it really is reactionary. They're not leading anything. They're just bowing to public pressure. But it seems like every time they bring something back, they do it in a, I'm looking for a polite way to say this, but they do it in an ineffectual way, like the contact tracing. You know, you dump it on the schools and they don't have the resources to do it, so they do it poorly. And then there's a whole nother month before Alberta Health Services picks it up. And what is your take on the effect that that's going to have on the infection rate?
So the infection rates will still stay high for certain time, and still kids will keep getting infected. So that's really not effective way of protecting kids. And it almost looks so, there is this dangerous idea going on that it's good to get infected if you are not in the risk group that will immediately die from infection, or, okay, I exaggerated, but that is not in a high risk of very, very severe outcomes. And kids are at risk of severe outcomes too, but lower risk than adults. And there is this idea that it's okay to let them get infected, which is absolutely dangerous. And in my opinion, it's not acceptable. But I'm afraid that this project somehow reflects this idea, because why kids are not protected? If one would assume that letting them get infected is bad, then one would protect them, and they are not protected. And the problem is, the sad thing is that vaccines are just around the corner for this age group. So maybe in 3 months they could be vaccinated, and they could be protected by vaccination. So even if somebody somehow believes that infecting kids will give them immunity, then why not waiting a little bit and giving them immunity by vaccine and not by infection? And even this is like, we didn't sign consent for that. Like, if parents would be upfront, like if decision makers would be upfront with parents, okay, we are aiming for herd immunity, and we want to infect your kids so they develop immunity and contribute with this immunity to the population. Do you agree with this? Do you agree with us letting your kids being infected, right? Like, but it's almost done without, it's just.
Is it fair to say, Gosia, because you're in the data all the time, right? I mean, you're crunching the data and modeling it and so on. And parents, the thing I hear from parents all the time is we don't have enough information to make a rational risk assessment for ourselves, or more particularly for our children. If we had more information, then we would be able to do a better job. And are we going to leave them in school, have them learn at home? What? And it seems like this is a very deliberate strategy on the part of the government to keep parents in the dark.
I think like everybody's being kept in the dark. Parents, citizens, businesses, we are not provided with information. We are not provided with information. What is the plan? What is the plan for the future? What is the plan for next 3 months? What is the plan for next year, next 5 years? It's not provided to anybody.
Is it fair to say, Gosia, that we can imagine a scenario in which the kids came out of last school year with low infection rates, very low infection rates, got through the summer, and then could have come into this current school year with effective measures in like masking and contact tracing and all of that, kept the infection rate as low as possible, leading up to the availability of vaccines for the 5 to 11-year-old cohort, and then had the minimum amount of impact, the minimum number of infections and suffering and, maybe long COVID and severe outcomes, as you put it. We could have had the minimum of that instead of the situation we have now.
Yes, we could, and it would be in ideal world. That's how it should be. So if we would have compassionate and caring decision makers, that's what they should do.
So we could have had we could have had the ideal world, in which in effect would be just a continuation of last year.
Yeah, that would be just continuation of last year, plus adding airborne precautions in schools.
Well, thank you very much, Gosia. The more interviews I do, the more it's either callousness, incompetence, or a combination of the two by the government and by decision makers within the various departments is becoming readily apparent. So thank you very much for this. Always appreciate your insights.
Thank you very much for inviting me.